Hi, I'd like to welcome Dr. Nishani Amerasinghe. How are you, doctor?
Very well, thank
Welcome
you.
to EZO.
Thank you.
Is it your first time with us in EZO?
It's my first time in the EZO and I'm really enjoying it. It's beautifully organised and it's such a wonderful venue. So yeah, really happy to be here. Thank you for the
We're
invite.
so happy and glad to have you as well. Tell me, how did you find, is it your first time in Abu Dhabi and UAE?
It's my second time in Abu Dhabi
Okay.
and I love it as a city. It's so vibrant, the people are lovely and there's lots of culture and the food is amazing. So
Yeah?
I'm very happy.
Have you got time so far to go around or not yet?
I haven't done much, but yes, I've been shown around a little bit and it's all been very
Yeah,
lovely.
hopefully you'll explore more through the 3
yes.
days.
Oh, definitely.
Dr. Nishani, tell me more about yourself. Dr. Nishani, the doctor, the mother, and the daughter.
Yes. So I am a consultant ophthalmologist at Southampton. I've been a consultant for about 12 years now. I have 3 children. The eldest is now at university.
And I got to know he's in Oxford.
Yes, he's at Oxford.
Wow,
Yes.
so that's an amazing thing to tell us about as well.
Yeah, no, he's really enjoying it.
Congratulations on that.
Thank you. He's in his second year now and really enjoying himself. And my other 2 younger ones, there's one doing his GCSEs, which is the 16 plus exam, and the other one's a year younger. That's my little daughter. She's 15 now though. So they keep me busy.
As if ophthalmology and glaucoma was not enough to get you.
That's my other side
Yeah.
as the mother. Yes, and at Southampton we're a big department, but not too big. So we have 4 consultants specialising in glaucoma, as well as 3 associate specialists. So we have a big team of senior consultants who can look after the complex glaucomas that we see, because we see a lot from the whole of the South Coast, the whole of the region, as a tertiary quaternary centre. So we're all very busy. Glaucoma is, and all we see is glaucoma and complex cataracts. So we're kept very busy.
Tell me, why did you choose ophthalmology? And more, why did you choose glaucoma?
So ophthalmology was something I sort of fell into. I knew I wanted to do surgery.
Okay.
But I did like the medicine side as well. I was doing my academic surgical job, which was the first surgical job I was doing. I'm thinking, yes, I really like this.
Surgeries.
Yeah, surgery. I really like surgery. What shall I do? And someone said, oh, why don't you go and see what ophthalmology is like? So I went and sat in the ophthalmology clinics for a few sessions. I hadn't really done that much at university.
Yeah, that's it. Because like in university, you just do a couple of weeks of it.
Yes,
So like,
exactly.
how did you choose it after that?
I know, exactly. We only did a week, actually, which we shared for some reason with them.
ENT or something else,
No,
another
it was
mark.
actually with GU medicine, so it was completely different. So we didn't get that much exposure, to be honest. And then when I sat in the clinic, I was blown away with how amazing it was. And, you had so many structures and so many specialties within the eye. The surgery was challenging, but it was nice, clean surgery. So there was so much to...
It's a very delicate.
Exactly. It's so intricate and it's such a challenge that I've just thought, this is what I want to do. By that point, I was, obviously qualified as a doctor by then. And I was slightly worried that because it was so competitive that I hadn't actually done very much to show that I wanted to be an ophthalmologist. But this seems to have worked out. Sometimes I'm here.
That's good. Tell me, why glaucoma again?
So
It's one of the very difficult subspecialties.
Yes. But I think when I was doing it, we didn't have this exciting explosion of innovation, which is brilliant. But when I started, the first ophthalmology job I did, I had a very inspiring glaucoma consultant.
So it's the mentorship, basically.
It's the mentorship. And actually, at that point, I really felt that glaucoma was the one where you had to rethink about the disease, and you also had to think about the patient as a whole, because we don't have cures for glaucoma that, like you may do with retinal surgery. With retinal surgery, it's on or off, and what you're doing.
Yeah, I always thought of it as a recipe, So it's like each glaucoma specialist will have his own recipe of treatment.
Yeah, that's a brilliant way of thinking about
so
it.
it's like
Exactly.
you're just doing your own recipe, your own treatment plan. So like I find it very fascinating, but as well very difficult.
And I think
you really have to have a good judgment for that.
Exactly. It is taking all those different ingredients, and there's slight nuances with it all. For one patient, you may put more of one ingredient, and others you bring it
you're
all
right,
off. Yes.
I'm right, we're all right, but everyone is doing it his own way.
And that's what's so interesting about it, but also what's so difficult about it.
Yeah.
And I think that challenge is what really enthuses me about glaucoma.
That's very interesting. Tell us about your non-doctor life.
So I'm, yes, mother of 3 children, and that keeps me busy.
How do you keep that? Like, how do you manage? Tell us more about, time management between being a mother of 3 and a full-time physician is really difficult. You should have struggled a lot through that.
I think it's the same with all working mothers.
Yeah, exactly.
It's getting that balance right, and sort of maybe overcoming the guilt with it as well. When you're at work, you're worrying about your children at home and thinking, is everything sorted out? And when you're at work, at home, you're thinking, I've got all of these other things to do, which are related to your patients and work. But I think you have to sometimes compartmentalize it. And, once you're at work, you think about work. And then when you're at home, it's all about the children and the family. But it is a difficult challenge.
Yeah. Do you have the days where you think that, am I doing them everything?
Yes.
Do you feel the guilt feeling with you? Do you take the guilt feeling with you to work?
Yes, you do. You've got to, But I think as they grow older and you spend time talking to them, and I've got to admit, I think the older they get, actually, the more time they need of you in a different way. So, when they're little, they need someone to feed them and love them and give them that physical nourishment. When they're older, they actually need more mental stimulation, and you're there to mold their character.
The role model kind of relationship.
Exactly. Yeah. And therefore some of that is actually providing the resilience and the role model, as you say, to be able to go out into the world and do things. And if you show them what your beliefs are and what your morals are, they can see that without you just having to tell them about it. They see what hard work can bring. And therefore, hopefully, are better characters because of it. So
I think, they should be proud of that. One of them is in Oxford, so that works very well.
I hope so, anyway.
Is there any one of them with you today to Abu Dhabi in the ESO?
No, I wish I had brought them. They'd have loved it here. But
for next year.
Next year.
The venue is definitely amazing to have them around.
Yes,
they're going to love being around.
Yeah, they would absolutely love it here. But school always takes first priority, so
it's okay. A couple of days.
Yeah, next time.
Yeah, that was really nice to know. Tell me, what are your hobbies, or what do you do in your off days or off time?
Apart from being most of the time,
full-time mother.
Yes, exactly. Most of the time, I feel like I'm driving my children to sports matches and things like that.
Taking them to their hobbies.
Exactly, taking them to their hobbies and their social lives. But I think. What are my hobbies? I think if you would ask my husband, he'd tell you straight away, it's giving presentations. That's what he says I do.
Working on presentations.
Yeah, working on presentations in my spare time. But we do a lot of things. And I like to set myself, think about things in challenges.
You obviously look in very good shape, so sports.
I don't do anything on a I do some things, more fitnessy things, but I don't do anything on a regular basis. However, having said that, I did set myself a challenge 2 years ago now. Yeah, about 2 years ago, where I wanted to increase awareness of glaucoma and also raise money for our pastoral
You're doing
charity.
the marathon?
I did. I know I didn't do the marathon, actually. I did another endurance event, which is ski touring, which is skiing uphill. And what I did was I climbed the equivalent of Everest on skis. So that was 4 days of 12-hour days. Each day you're doing the equivalent of doing 3 marathons back to back.
Wow.
So, it was not just about
That's
the training.
That's impressively amazing.
It was quite hard work. It was one of the hardest things I've ever done. The temperatures went from -20 to +4 degrees. It was very cold.
Where was that?
It was in Switzerland, in Verbier.
Wow.
It was an amazing challenge, and it did push you to extremes. But I'm glad I did it.
It challenges you to see your extreme. Where can you go to?
Exactly, exactly. And again, I suppose that's another thing to show the children that we can push ourselves
How
in
determined you can be.
Exactly, push yourselves in other ways. Because my children and my husband are very sporty, but I'm not very sporty at all. So I thought I wanted to show them that I can do something as well.
Obviously,
so,
you
prove
did
it
something.
to them. So yeah, that was an amazing challenge, and it did create a lot of awareness. I did a lot of radio and TV shows and things and interviews.
So how was that while you're going there? Like, is there...
So I did some when I was there. They did interview me. Some of the news channels interviewed me while I was there because they wanted
So
to
is
just...
that a group activity or is
So it was a group activity in the sense that you sign up for it, and so we had expedition leaders and things. So you
okay.
had
and all of you are for the same cause?
no, so lots of people
everyone
doing
does it for...
different causes, and
Okay.
but for me it was Glaucoma UK, and it did work in kind of raising awareness. We also raised quite a lot of money for the charity as well. So
Wow.
yeah, it was a good thing. It was a
That
yeah.
is an amazing thing. It's a double win.
Yes,
Are
exactly.
you doing it for yourself and you raised like fund for
Yes,
the
yeah,
glaucoma
exactly,
awareness?
exactly. So yeah, no, you're completely right. It was a double win.
Yeah, that's amazing. That's really amazing. Interesting. Tell me, how would you challenge yourself? Telling me that like, you've done this exercise just like to challenge yourself out of your comfort zone. So like, how would you do that? If I would say at work or like surgically or like...
I think it's setting goals for yourself. So maybe now I obviously did my fellowship in Singapore, my research fellowship, and I did quite a lot of research then.
the Singapore Eye Institute.
Yes, at SNEC. So I was with Professor Wong as well.
Oh,
and then
that's
I
amazing.
was,
That's just another part of the world.
yes, my other part of the world. Yes, so I did
Wow.
2 years in Singapore.
Wow.
And yeah, I had a baby out in Singapore while I was doing the
Wow.
research, so balancing all of that. And that was excellent. It's amazing facilities, amazing research. But coming back to the UK and NHS busy clinics, I haven't done that much
Of the
research.
research,
It's
yeah.
very hard to kind of balance it all. I think that would be probably my next goal of doing more research. But I like to do these things, set little targets for myself.
Small targets. to
Small
achieve.
targets, and then
Yeah.
achieve it, and then achieve it.
Yeah.
Actually achieve it, because I think if you say, "Oh, I want to publish a paper while climbing Everest, while looking after the
Yeah.
children," it just doesn't happen. And obviously, doing the president role last year, that was all consuming. Working with the college and government bodies and things like that. So that was it. So that's all I've really been concentrating on outside. Well, it's a professional and outside work challenge. I just let that be done and done well. And obviously I'm still on the board now as past president, and I'll be there for another year. And then there'll be other goals that I'd like to do. I'd like to promote women in glaucoma. So,
we had a session last year about women empowerment in
yes,
ophthalmology.
yeah.
That was a really nice
and that's the kind of
session.
thing that I really want to do. I mean, when I organised the UK and Air Glaucoma Society meeting last year, and we got a third of the speakers on the podium were women, which was the highest that had ever been. And it's just little things like that I think it helps.
Small milestones.
Exactly. Very
Reach
small,
your big
but
goals.
actually, it was amazing how many trainees came to see me afterwards and said it was so nice just to see women up there and think actually I can do this. And we all
You're
can
just
do
setting
this.
goals for others.
Yeah, exactly.
Yeah.
And I think that's really important. The other thing that I'd like to do more work on is sustainability in ophthalmology. So, us using less single-use eye drops. We've got multi-dose preservative-free formulations now. Why not just use those and help the
I
environment
think that's
that way?
a very coming subject that have been in the past couple of years.
Yes,
the
yeah,
sustainability and sustainability in ophthalmology.
Yeah, so that's my other goal at the moment.
Really nice. That's really amazing. I can see you have many goals. Actually, you have lots of full calendar to go for.
Yes.
Tell me more about your academic career. I know you're running a fellowship in glaucoma.
Yes.
One of our colleagues who just came, and we're proud that she came from your training. We're seeing that she's amazing and what she's doing currently. And obviously she had you as a role model. Tell us about that. Tell us about your academic and
fine.
training.
So we run a very good fellowship, I feel, both a junior fellowship and a senior fellowship, actually, because we're a group of 4 consultants, and we have a big population, and we have our own local population as well. We can expose fellows to the whole gamut of glaucoma, and yes, maybe the early glaucomas aren't as challenging and exciting in some ways when you're just looking at the quite mild disease. However, there is a big burden of them. And it's about managing them. So, manage them in a different way with virtual clinics, community clinics. All of this is something that, as a glaucoma consultant, you need to manage a whole service. And so fellows get good exposure on that side of things. It may not be that they're seeing these patients face to face in clinics, but they learn how virtual structures are implemented, or things are implemented in the community, right the way up to very complex glaucomas, end stage, secondary diseases. We have a big ocular genetic department at Southampton, which means that, and those patients grow up, and so they transition into our clinics, and it's learning about looking after young adults with very complex needs and glaucomas as well. So it's a really interesting fellowship, and I think it really covers glaucoma in a really nice way.
Yeah.
And with 4 of us, it does mean that, the different chefs with their different ingredients.
With the different recipes.
Exactly, with their different recipes. The fellow gets exposed and sees that actually there isn't one way of doing things.
Yeah, they grow to do their own recipe.
Exactly.
So I can see the 4, learn from the 4, and build my own.
Exactly.
Yeah.
And I think a fellowship should always do that. It's not about, and you as a teacher should always do that. It's not my way is the right way. I will show you my way, and I'll explain why I do it my way. But that doesn't mean that it would be right for you. Take the good points that you agree with, mix them with the other experiences you get from other colleagues, and make your way.
Yeah, I totally agree. That's really amazing. For me, I feel that that's the best way of doing a program. It's not only the academic thing. It's the academic thing, and it's the logic and intellectual of problem solving, making up your decision, growing as a person that takes his own decision and take responsibility for the choices he does.
Yes, I completely agree.
Yeah. So, we come to an end, I think, of our talk, Dr. Nishani. That was very nice to talk to you. Very interesting talk. I really enjoyed my talk with you.
Oh, thank you.
And hope to see you again in
you.
ESO.
Oh, thank you.
You're welcome.